Hello to everyone in person here at Armor Heights, or perhaps online or taking this presentation in at another time. We just want to welcome you, and if you are watching this presentation in real time, there will be opportunities for questions, so you are welcome to enter them into the chat, or if you like, you can also email them to me at estone@armorheights.org. And with that, we're starting a bit earlier, so the great thing about YouTube is you can rewind and play back, so forgive us for starting a little bit sooner. And now I believe I will hand it over to Dr. Harris to do our introduction.
Welcome. Is it Shrid? Shrid?
Yes.
Dungle? Dungel.
Yes.
Okay. See, we all tried to guess. I've got a complicated name myself, so I know all about that. Welcome. And this is, as many of us here have been involved at different stages of caregiving, as we know from the stats that were given to us, and my understanding is that you're going to explain that this is something new, right? That the province is kind of wanting to encourage. And I think for us, any resource, any support, certainly not only for ourselves, but also neighbors, friends, family. I'm sure all of us here have some connection to someone who has been or is currently or will be at some point inevitably involved in care. So I don't want to take too much time. I know that some of the stats, and Jane was very good at passing some of those on to us. As many of us will not be surprised, women shoulder much larger percentage of the caregiving than men do. And the statistics are pretty alarming in terms of how much this happens. Sometimes we can feel that we are in our own bubble of being overwhelmed or challenged in terms of figuring out how to navigate, how to work. But it is something that so many people around us are also doing. So we're grateful you're here, and we look forward to what you have to share, and no doubt many of us will have lots of questions for you.
Thank you so much. I'm going to put this back. And you said it correctly. I think Rosalind Carter is the one who said that there are 4 types of people in this world: one who is a caregiver, one who was a caregiver, one who is going to be a caregiver, and one who knows a caregiver. So there are 4 types of people in this world, and we're here at the Ontario Caregiver Organization to support family caregivers. I want to say thank you to the church, to Erin, to Dr. Harris, and to Jane for inviting me today. I have this issue, I have this big problem in my life. I can never say no to Jane. So whenever she requests me to do something, I have to say yes, even if it's a Sunday and driving from Niagara Falls, I am here, right? So happy to be here. Okay. So today we're going to kind of focus our conversation around who the Ontario Caregiver Organization is and what we do and how we support caregivers. And don't be shocked that if you leave the room today thinking, oh my God, I have been a caregiver and I did not realize that I'm a caregiver, right? Because it is very true, right? So we're going to talk about who OCO is. We're going to kind of go over an overview of what caregiving looks like in Ontario, right? And then we're going to talk about what services we have and how we can help caregivers. And I'm happy to answer any questions that you might have. If I am going too fast, which sometimes I tend to do, please just pull up your hand and say, hey, back it up. And I'm more than happy to repeat whatever you want me to as well. So I would like to begin today by acknowledging the Indigenous peoples of all the lands that we are on. While we meet on this in this ground, with people joining us from across Toronto, I imagine, I would like to take a moment to acknowledge the importance of the land. As an immigrant to this land, I have a deep appreciation of this place that now my family and I call home. I'm continually learning the history of the land, recognizing that that history has seen immense tragedy, hardships, and injustice. However, trying to understand that tragedy and injustice, and by standing with the Truth and Reconciliation Commission, my family and I have renewed our commitment to honor this land. I invite you to take a moment to reflect on the land where you are, and if you're not familiar, you can go to native-land.ca, and you can interact with the land to see where you are and what the history lies. So, who are we? What is the purpose of the Ontario Caregiver Organization? Simply put, We exist to improve the lives of caregivers in Ontario. And when we talk about caregivers, we're talking about unpaid caregivers. Brothers, fathers, daughters, friends, family, neighbors, whoever's providing care to someone else in an unpaid capacity, we help support that individual. We work with all caregivers across the province, regardless of age. So we have caregivers from 15 years and above. And we also work, we are non-disease specific. We don't worry about diagnoses. We work with anybody who identifies as a caregiver, which I will talk a little bit around identity later on in the presentation as well. How do we do this? We offer a lot of free programs and services, which I will go over momentarily. We collaborate and partner with agencies such as Mosaic and other agencies to offer programming and various education opportunities for caregivers to better understand what their experiences are in caregiving so that they are not burnt out or do not reach a point of burnout, which is very real for caregivers, right? We work with healthcare providers. We hear a lot of the time from providers saying, okay, we have a patient coming in and somebody who is accompanying them who says they're a caregiver. What am I supposed to do? How do I kind of support this individual? So we help providers by, number one, identifying caregivers, helping them through that identification process. Again, I'll speak to that a little bit later. As well as engaging caregivers in both the decision-making process as well as engaging them around their own self-care. And then third, supporting them by offering them different resources as well as referring them out to programs that make sense based on their need as well. And then most recently, we've also launched our Employers and Workplace program, which is we're working with anybody who wants to work with us, for-profit, non-profit, it doesn't matter, where we're trying to work with organizations to make them aware of what caregiving is so that they can, in turn, look at their policy and create more caregiver-friendly workplaces, caregiver-inclusive workplaces, so that caregivers who are feeling burnt out because of their caregiving responsibilities don't take that burnout into their workplace, which might lead their productivity to go down, right? So we're working with workplaces to make that happen as well. So, who are caregivers, right? I talked about that identity piece. A big part of what we do is we work with individuals to self-internalize the term caregiver. For a lot of people, caregiver is a professional term, a PSW, a nurse, a social worker, who have you. So the way that our system is set up, right, if you identify as a caregiver, it allows you to access resources that typically you might not see yourself accessing. And number two, if you identify as a caregiver, the response from a provider and the response from the healthcare system is a little bit more different than, say, if you were a visitor. For example, we have essential care partner programs in different hospitals now. One of the things that we established, which takes away, it gives people who are associated with a care recipient or a patient a caregiver ID rather than a visitor badge. What does that do? It allows them to access the person, the patient or the care recipient at a different level than a visitor would. So the things like visiting hours don't apply to them. Because we've seen, research has shown us that if a caregiver is present at the bedside, then the care recipient or the patient's health outcomes are much better than if the caregiver is not there. In COVID, there was a study that was done out of the US where, because of these restrictions where caregivers were not allowed to be in the bedside, hospital falls went up by 700%. Right? That is a huge number. So it just shows the importance of having the caregiver there to ensure the safety of the patient, right? What we also identify is that every caregiving journey is unique, right? Everybody, even though they might be looking after someone with dementia, the way that the disease progresses is different, right, for each individual. So the caregiving journey for that individual also is different. And each journey has a lens, has a immigrant lens, or an age lens, or a location lens, right? If you're in a rural setting, the way that you access your services is different than you were in an urban setting. Or if you are an immigrant and don't necessarily speak English as your first language, the way you access services is different. So we really recognize that it's different, and also there are definitely cultural biases when it comes to caregiving, and there are a lot of cultures where the term caregiver also doesn't exist. It's very innate, it's part of what you do as part of growing up. You take care of your mom or your dad or whoever it may be, right? So there is pushback in some cultures. For example, we work with Cantonese-speaking caregivers who really pushed back on the term caregiver, and we had to really say, hey, yes, we do understand that your culture doesn't, allow you to define it such a way, but now that you're in Canada, again, going back to the way our system is set up, there are benefits to being identified as a caregiver. So we really try and work on an individual basis, and Jane is a great proponent of person-centered care. That's what we do. We go by the individual and understand their needs and offer services and supports based on that. We also know that caregivers take on a whole range of roles and responsibilities, right? So these are a list of 12 things, but within each of these, there are probably 20 different tasks, right? Medication management, you have to go to the pharmacy, make sure that you get the right medicine. You have to, make sure that they're taking it at different times, right? A whole range of different things. When it comes to transportation to the hospital, back to the physical therapist, back to the grocery store to get groceries and make sure that there's food in the fridge. So a range of different things, right? So we know that because of all of these, and because caregivers were not formally recognized before, a lot of people are at the point of burnout, right? They are reaching that point of burnout, and we are here to support them. And there are a lot of barriers when it comes to caregivers accessing support. Barriers from the caregiver themselves, because a lot of the time, the focus is on the care recipient, and they tend to forget about themselves, right? And then barriers from the provider, because again, the focus is on the patient, right? And they're not interested in the caregiver as much. We always say, think about the airplane analogy. First, you put the mask on yourself before you can put the mask on someone else. So make sure that you are well taken care of so that you're better able to take care of the person that you're essentially responsible for, right? And then there are other barriers as well for accessing caregiver support. And one of the newest ones now is that caregiving has been added as a social determinant to health, right? If you are a caregiver, the way that you access support for the person that you're caring for and for yourself is completely different than if you're not. And what it also does, it removes you from social circles. It was one of the biggest things that we see when you become a caregiver and when you identify as a caregiver, specifically for younger folks who are in college, university, right? Social circles, they do not understand what caregiving means, so they lose social circles, and which results in isolation. A lot of caregivers end up living very isolated lives away from things that they normally would be engaged in, right? So we try and work with the caregiver to offer supports in creating social circles, for example. And I'll let you know how we do that as we go through the presentation as well. Everybody good so far? Awesome. So now let's look at what caregiving is in Ontario. So we know that there are more than 4 million caregivers in Ontario, but that number is on the rise. We know that by 2030, we will have close to 6.5 million people in Ontario who are going to be essentially a caregiver. We know that caregivers can be of any age range, but a majority of caregivers are between the age of 26 and 65, who we also call the sandwich generation, because they're sandwiched between taking care of folks older than them in their lives, as well as younger children and others in their lives as well. So they're the sandwich generation, right? So we see that number on the rise as well. The caregiver, care recipient dynamic is also now not one-to-one, it's one-to-many or many-to-one. What do I mean by that? So if there's a father, mother, daughter dynamic, the mother might be the primary caregiver to the father, and the daughter might be the secondary caregiver to the father, while also being the primary caregiver to the mother, because the mother comes with her own set of ailments as well. So we're seeing all of these dynamics also play out, and that is not reflected in that 6.5 million. If there is an individual who is taking care of more than one person at the same time, there's still the one unique caregiver, right? But the amount of work that they're doing is now double, right? And then we also know, and this is why we established our workplace program, caregivers are having to change the way that they're doing work, and they're finding it very difficult balancing work and caregiving, right? More than 70%, this is post-COVID, more than 70% of caregivers have had to change their work structure, right? From part-time to, from full-time to part-time, or shift-based, or different ways of or doing consulting from full-time jobs, right? And we're seeing this not only in the outside the healthcare field, but also within the healthcare field. We have a lot of nurses, for example, who are changing the way that they're working, and they don't want to be tied into one particular job because of what COVID did, right? So that's also on the rise. And we know that the average amount of care that a caregiver provides is about 10 plus hours, right? On top of what their normal daily work life is, right? So think about it, in the evening after 5, if the person's away is awake until 8, for example, in those 3 hours they're packing in a lot of different things that they need to do for the person that they're caring for, right? And 73% said that the responsibilities have increased in the past 2 years. And this is specifically because of COVID and the vulnerabilities associated with COVID. Caregivers are finding it difficult to allow people to come into their home because of all of the, again, vulnerabilities. So they're having to take on a lot of those responsibilities that normally someone else would be coming into the home to do for them, right? So we see that as well. So caregivers are critical to care recipients. We talked about this. We talked about how patient safety and care recipient outcomes are very tied in with caregivers, and if they're well supported, then caregivers feel more confident in being able to provide care for the care recipient, right? 94% of caregivers feel that their involvement in care allows greater safety. 94%, that's a huge amount, right? So we really need to kind of support caregivers in that. And then caregivers are critical to our society as well. There was a study out of University of Alberta, University of Manitoba, that said that caregivers contribute to about $97 billion in the care economy per year, right? So without caregivers, our healthcare system would essentially collapse, because caregivers are taking on over 75% of the care, right, for the person. Because think about it, if you go to the hospital, that 1 hour visit turns into a 15-minute visit because the doctor doesn't have more than 15 minutes. After that, everything that is required, from medication, filling prescriptions, to getting to appointments, to making new appointments, to making sure that they're comfortable at home, everything is on that caregiver. So it's really important that that caregiver feels supported, right? Okay, so when we talk about experiences of caregiving, right, it impacts caregivers in different ways, right? And I actually printed out the most recent stats, so I might be reading for some parts of these, because I wanted the most recent stats for you guys. So caregivers are impacted for their time. We talked about employment, their finances, that's a big one, right? Because they're spending so much money on the person that they're caring for, it does take a toll financially as well, right? But going back to that identity piece, if someone does identify as caregivers, for example, and the way our system is set up, they might be eligible for the caregiver tax benefit. A lot of people don't know that, right? So again, that's how our system is set up. That's why we really encourage that identification piece as well, right? And then health and wellness, definitely it affects their health and wellness and personal relationships as well, right? So 34% provide more than 10 hours of care per week. 3 in 4, 73%, say that their responsibilities have increased over the past 2 years, largely due to the growing care needs of the care recipient. And for a lot of people, it's because the complications of COVID have made it difficult, right? And 50% say that their ability to take breaks has declined, right? While simultaneously, their needs to take monthly breaks have increased. There are a lot of caregivers we are also noticing who, because they don't have the option of taking breaks, will drop off the care recipient at the nearest emergency room, because that is the only option. We're seeing that on the rise. So emergency room visits for non-emergency related cases, specifically because of caregiver burnout, is also on the increase. That's another thing that we're seeing as well, right? In terms of employment, over half are finding it difficult to balance care and work. 74% are making changes like flex hours, early retirement. That's a big one we're seeing. A lot of people retiring early because of caregiving responsibilities, right? And silent quitting. That's what they call silent quitting. So there are some people that it's become so hard that they're just like, you know what, I'm done. I can't do this anymore. And then that's where they drop them off at emergency or even in long-term care settings sometimes, right? So we're seeing that as well. And then many of the caregivers are using their benefits to provide care, not for their own personal health or well-being, but for the well-being of the person that they're caring for as well. And 64% say that they need more support from their employer. And that's also another reason why we established our workplace program, is to talk to these employers to make them understand the challenges around caregiving. Finances, right? So 75% say they need more financial support, right? It's consistently the biggest area of need and stress for a caregiver, right? Finance. 57% use their own personal finances, spending an average of $641 per month out of pocket towards the care recipient, right? Initially, that might not seem like much for a one-time thing, but over time, 641 over 5 years, every month, that's quite an amount, right? And 1 in 4 caregivers have taken out a loan or a line of credit, yeah? And others have used their own retirement or savings account to kind of help with those financial requirements as well. Over half of caregivers are struggling to manage their own emotions. So that's the other part of what OCO does, and I'll talk a little bit about that as we go, is around managing your own emotions and your mental health needs, right? So that's something that we do as well, and we offer at OCO. So nearly 80% report feeling tired, is so tired that it's difficult to get anything done beyond the essential caregiving tasks, right? So housework, cleaning, it goes out the window. That's why we see a lot of caregivers, unfortunately, who are not able to throw away stuff and might lead to hoarding, and a range of different things that we do see. So we have organizations that help through that process as well, and we're able to refer caregivers to that as well. And then 75% are concerned about how they will handle their duties going forward. So we also have a report called the Preparing to Care report, which shows that there are a lot of caregivers who are worried because if they are not able to do the caregiving, then who's going to step in, because there's no one else to step in for them as well, right? And then lastly, personal relationships. And this, again, COVID has really put a strain, because one of the key things that we see is caregivers are having to take on more complex caregiving tasks, right? Complex medical tasks even. Things like giving injections, changing catheters, which professionals were coming into the house. Now caregivers are having to do that. And for a patient with dementia, for example, that completely changes the way that they see the caregiver. They might be a father or daughter, but because of dementia, now the person is more a professional, medical professional, and a patient. So it changes, and it leads to ambiguous loss, and they're grieving ahead of time. So a lot of different things for caregivers, they experience this, and especially because of COVID, we've seen these on the rise as well. Whew. However, right, we do hear from caregivers that more than 90% of caregivers say, we will do it again if that opportunity arises, right? And for all these reasons, right? It's fulfilling. For a lot of people, it's bonding. A lot of caregivers say that, I was actually estranged with them, but now I'm closer to them, right? It helps them. And we hear from caregivers all the time that, yes, it is challenging. Yes, there is all these things that I talked about, but it has been a rewarding experience at the end. And if it happens again, I will take it on, right? Which I think is a good sign, right? So, okay, so after all of that, how can we help? What do we do? What do we offer? What are we doing for caregivers, right? So okay, I'm going to skip that and go into this one, okay? So we offer a range of information and resources. And like I talked about around that person-centered approach, we really, at OCO, try and make sure that whatever we offer in terms of our programs and services, information and resources, that we're catering it to that particular individual based on their cultural norms and their cultural identity of what caregiving looks like, right? So we have resources, for example, in multiple languages. Like we have the I Am a Caregiver resource, which, like the name suggests, for a lot of people, they don't see themselves as caregivers. So this toolkit really helps them. It lists a lot of activities around what kind of things that you do on a daily basis to make you realize, oh yeah, I have been doing this for a number of years now. I must be a caregiver. And that helps towards that identity piece so that you can access further supports based on the needs of the caregiver as well. We have a range of webinars on topics within the health, well-being, and emotions side of things, financial and legal tips. So during tax season, for example, in February, we partner with the CRA to offer webinars on the caregiver tax benefits and how people can access them. And in the past 3 years that we've started partnering with CRA has come back and said that the number of applications for the caregiver tax benefit has gone up exponentially than 3 years back, because a lot of people did not know that this even existed, right? We also offer webinars on caregiver skills and personal development. So we offer some training, we offer coaching around how to better do money management, for example, right? So that's something that we also offer. And then also we partner with different condition-specific organizations like the Alzheimer's Society, the Epilepsy Society, ALS, to kind of offer condition-specific webinars on how they can manage the care for that individual as well. We offer toolkits beyond the I Am a Caregiver toolkit. We offer a toolkit around work and caregiving. How do you have conversations in your workplace around what it means to be a caregiver, and how do you engage your manager and your director to making those changes around so that you can be better productive at work. Big thing that we hear from caregivers is, if I'm not around, then what, right? I talked about that. So we, in partnership with caregivers, we created the contingency planning and emergency planning toolkits, where you can lay out all of the things that are required for the care recipient and for yourself as part of the contingency and emergency planning toolkits, so that in the event, if you're sick, or if the caregiver is sick, if the caregiver needs to be away, whatever reason, someone else can come in, pick up the toolkit, and everything is within that toolkit, so that the person can continue to offer the same standard of care that the caregiver, the primary caregiver, is able to provide, right? And then for the emergency toolkit, we ask that both the caregiver and the care recipient fill out the emergency toolkit. First responders know, for the most part, to look for these toolkits on the fridge, right? I know that the Toronto Paramedicine also does that. So a lot of first responders, if they respond to an emergency, will look at the fridge to make sure, or the back of the door, to make sure that these toolkits are available in the event that someone is a caregiver or is in an emergency. On the flip side, we work directly with employers. So if you're a caregiver, but we reach out to employers to offer them guidance on how to proactively look at their policy to make those changes right ahead, and make sure that their workplace is also is caregiver inclusive and caregiver friendly as well. So we've been doing that with RBC recently. We're doing that with Hydro One. We've been doing that with a couple of different for-profits in Toronto, and a lot of hospitals as well. So a lot of hospitals are also looking, because double duty caregiving is a real thing, where there are a lot of people, nurses, PSWs, social workers in the hospital, who are now going back home and offering the same support to the person that they're caring for as well, right? We offer e-learning. So we have an e-learning platform, right, where you can go and take a course around what caregiving looks like, right? And I should mention, everything we offer is free of charge. There's no cost to any of our programs. For this e-learning platform, the only thing you need to do is create a username and a password. That's it, right? And then the other thing that we hear from caregivers is, I don't know how to talk to providers. I don't know what to say, like what's private, what's not, right? So we have a course on partnering with healthcare professionals and speaking to healthcare professionals, making sure that healthcare professionals understand the care recipient and their needs beyond that particular visit. When you go to doctor's visit, you're going for one complaint, and the doctor will say, I can only see you for one complaint, right? But we kind of offer tools on how caregivers can advocate, saying, okay, yes, this is one complaint, but there are many things happening at home that's causing this one thing, right? And being able to advocate on those as well, right? And then specifically for those caregivers looking after someone with a mental illness or an addiction challenge, we offer a course on that as well. And then there are individuals who don't want to open a computer. You know what? Too much. I don't want to do that. We offer a podcast you can download to your phone, right? And we invite subject matter experts. We invite caregivers to have conversations on different caregiving topics. I feel overwhelmed. I'm stressed. You know what? I don't know how to. I seem to be spending a lot more money than I have in the past. What can I do? So having these conversations with subject matter experts and other experienced caregivers, right? It allows people to kind of create their own strategies so that they're better able to cope. So we offer this podcast through any podcast provider. So if you go to Google and say "Time to Talk OCO," then it'll come up and you can just listen to it in your own time as well. And the other thing is around privacy and consent. So there's a lot of gray area, like, okay, what's the doctor allowed to tell me, or what am I allowed to tell them, or can I be part of this visit, or can I not be part of this visit? So we've taken a suite of these resources around privacy and consent, and we've really adapted it for plain language so that everybody can understand, both caregivers as well as even me as a provider. Like, I don't understand the legal jargon, so it's really complicated, right? So it really, these resources really help put everything in plain language so you understand what your rights and responsibilities are, and you can also offer those to the provider, saying, you know what, these are what are available from OCO, and this is what OCO told me. So then you have that with you as an arsenal, right? So you can use that as well. And then we offer newsletter as well. So we offer monthly updates around different things happening around caregiving across the province. We offer a weekly 90-second read. So we partnered with a geriatric professional to create what we call these 90-second reads, where caregivers receive a email every Wednesday, and you're able to read it in 90 seconds. And based on interest, you click on more. So these topics are like I talked about, right? Okay, personal relationship, dynamics, money management, whatever it may be. So you don't have to read everything, but if you like it, then you can click on it and find out more, right? So the click rate for that is the highest we've ever seen. 90 seconds is easy, right? So it's been a great addition to our resources as well. And then for providers, we offer a quarterly newsletter around the different partnerships that we do to offer services for resources for caregivers as well. So those were our information and resources that we offer. Everything is available digitally. I have left our postcards here as well. You can take a look at it as well. Now let's talk about our free programs and services, right? So our biggest thing that we offer is system navigation help. Caregivers, once they are caregivers, or even if they are seasoned caregivers, they want to find services for the person they're caring for or for themselves. They can call this number right there, right, which is on those postcards right there, and you can say, hey, I'm looking for, I'm tired of cooking. I have so many things to do. I'm looking for Meals on Wheels, whatever it may be, right? Then based on your postal code where you're calling from, the resource specialists at the end of the line will find a resource for you. And if they're able to, they will directly register you for those resources. If they're not able to, then they'll refer warm transfer. That's what we call warm transfer. They'll call the other person, make sure they're on the line, and connect you both so that you're able to access those resources. Whether you're looking for respite, whether you're looking for help, caregiver funds, whatever it may be, right? You can call this number at any time. It is in partnership with 211 Ontario, but we have our own set of staff that we've trained from 211 to respond to caregiver-based inquiries, and they're able to offer resources based on your needs as well. There is live translation available in 150 different languages as well, and if you want to chat with them, there is a chat feature as well, which is available Monday through Friday, 7 a.m. to 9 p.m. We also offer peer support. So going back to early in the presentation, I talked about how caregivers lose social circles, right? So we are able to offer the peer support program so that caregivers can connect with other caregivers who are going through similar situations and create bonds, create friendships so that they may be able to kind of talk with each other and strategize with each other and offer peer support to better take care of the person that they're caring for. So we do this by two ways. One, we offer group peer support programs throughout the week. And then we also offer a one-to-one peer support program, which is more one caregiver with another caregiver who is a peer mentor, who's gone through peer mentorship training with us. And they kind of mentor the caregiver who's having issues with whatever they're having issues with over the phone, have a conversation once a week. If they feel that, oh, you know what, we happen to live in the same area, well, let's meet for coffee, then that's fine as well, right? And offer that one-to-one peer support for the caregiver as well. And we do offer the one-to-one peer support on a 6-month basis. If, for the most part, caregivers move on to other programs, but if they feel that, oh, you know what, I want to extend a little bit more further, then we are able to do that as well. We also offer caregiver coaching. This is more robust coaching on, you know, I am having issues, I'm at burnout, I don't know what to do, I have all these bills, and I have all these papers, I don't know what to do, I need help, even sitting down and making the contingency toolkit and writing it out. Okay, let's refer you to our coaches who will guide you through that process. It's a 6-week program where you meet once a week, I think, with the caregiver coach once a week, and then you kind of create short-term, intermediate-term, and long-term goals, and they help you coach you through that. They help the caregiver or coach the caregiver through that process as well, right? And the coaches are also experienced caregivers themselves. And then around that emotional piece, right? So we offer a program called Scale, which is around nurturing a caregiver's mental health and well-being. It gives the caregivers the tools to better recognize their mental health needs, right? So these are weekly psychoeducational webinars that they can attend, either live or recorded. And we offer this live twice a year, but folks are able to go to our website and watch the recording anytime they want. When it is offered live, we also offer free individual or group counseling, just based on need and based on assessment as well. We do partner with agencies. So if tomorrow Mosaic comes to us and says, hey, we want to run Scale in person. So we have a new program called Scale Together, where we can run the program in person, the same 8 weeks, and then have like a discussion, a debrief discussion after on that topic as well, right? So that's something that we're slowly starting to also offer to our partners as well. But yeah, so the topics are very pertinent to the caregiving experience around that emotional side of caregiving, right? So that people, you know, who are at burnout or close to burnout are able to navigate that and recognize that in themselves as well, right? And then we talked about supporting providers. We work with providers in that identify, include, and support piece. A lot of the time, including caregivers is easier said than done, but we offer resources to providers on how they're able to include caregivers in that decision-making process, right? A lot of the time, caregivers say, I wasn't consulted for this, but now I have to do this, right? Letting caregivers completely understand why, the rationale behind all of the different things that are happening with their care recipient really helps in ensuring that the care recipient is well taken care of, right? And it's not something that the caregiver is doing because somebody said so, but because it was a decision that was reached together, right? And then eventually supporting the caregiver, again, making sure that the caregiver is also well supported to take care of the care recipient. We partner through all of our regional leads. So like myself, we have a team of individuals who travels across the province to offer programs such as these. And then also, if folks are looking, again, like Scale Together, to do a more in-depth, robust programming in their different centers, we do that through our teams as well. And you can see, coincidentally, both their names are Katie. You can see the two Katies who are together in that image. And if you are a caregiver, or you were a caregiver at any point, and you want to give back, and you want to kind of be part of the process, and you want to be a peer mentor, or you want to be a coach, or you want to be part of our advisory committee, we have different opportunities for caregivers to give back. All of our programs, all of our resources are co-designed. That means when we create something, we make sure that caregivers first look at it and say, yes, this would be helpful, before we publicize, right, before we publicly promote those resources. So everything you see, all of our programs come from our caregiver advisory panel, and they vet everything that we do. So, yeah. Thank you so much. Again, my name is Shrid. I hope I didn't bore you. Right. I'm happy to answer any questions if you have.
I'm just going to get the microphone so that we can move around so people
Sure.
can hear online as well.
And if you're able to, then you can scan that little QR code and fill out an evaluation. That would be helpful as well.
Questions? Yes.
Two things, a comment and a question.
Sure.
First of all, I wish you'd been here 35 years ago when my Aunt Nancy, who's now 95, was caring for her parents. And even now, she will mention her guilt at putting Granddad in the Veterans Center at Sunnybrook Hospital. She's never gotten over that. It was a safety matter. But I'm certainly going to pass this on to her. Aunt Nancy now lives in Nova Scotia, and she's in a facility. I don't think there's an organization like this.
There is.
There is?
So there are 5 caregiver-based organizations
Okay.
in Canada now. The newest one, I think, is in Newfoundland, if I'm not mistaken. But there's one in BC, Alberta, us, Nova Scotia, and now I think.
Oh, wonderful. Yeah. I'll pass that on. How would I access that?
Google.
Oh, okay.
But I can help you after. I can give you the information.
Okay.
Yeah.
Thank you so much.
No
Anyone else? Questions?
Yeah, we were established right at the cusp of COVID. So 2019, March 2019 was when we were established, Ontario. So we're relatively the newer ones, and now Newfoundland. But yeah.
I have a basic question. Just how does the program work? If I wanted to be a volunteer, I contact you. If I'm like the aunt needing support, does she contact you? I don't know how it works.
Sure. That card that you see right there,
Okay.
there is a helpline number. You call that helpline number, and that's your way in. I want to be part of the advisory council, or I need support. That number is your go-to number for everything. Or if you want to just connect with me, I'm more than happy to connect you as well. There's my email, but I think phone numbers are easier, right? So just calling it up.
Anyone else?
Just another question. So is this funded by the Ontario government?
Yes, so Ministry of Health.
Okay.
Most of our programs are funded by the Ministry of Health. We, as of about a year and a half, 2 years back, we are a charitable organization, so we do have a little bit of other funding mechanisms as well.
Yeah.
But primarily, I'd say 80% of our funding is Ministry of Health.
Okay, and you have staff?
Yes,
Okay.
across the province.
Okay.
So we have staff. Our office is in downtown Toronto, but it's one room. We have mostly staff everywhere, from Ottawa to Thunder Bay to everywhere, yeah.
Yeah, thank you.
Anyone else?
But we are a virtual first organization. Most of our programs are virtual. We've only recently started doing more in person like these, as well as the skill program. We've recently recognized that there is a capacity for that and there is a need for that as well. So yeah, and then if someone like Jane reaches out, you got to do it.
It's kind of a question, but it's more of by the way. So we have a lot of people who join us for worship and are part of our community from other provinces. So I can imagine they could still get a lot of the resources that are available through their website.
Absolutely. We, like our webinars, for example, or the Scale program, we have like 3,000, 4,000 people who register for it. And we have folks from Australia who've joined our programs. It's online, right? So anybody is able to access it. The resources are specific to, like if you're looking for something in Ontario, that's different. The helpline is specific to Ontario, but the literature can be used for everyone, yeah.
And I also want to add, we have a resident expert on site, Jane Teasdale from Mosaic. So if you forget all of what happened in the presentation, we can always connect you with Jane. Also, we didn't mention it before, but if you haven't gone downstairs past that exit sign, we have a resource center downstairs that is open. Whenever the church is open, you can always wander down. There's so many materials in addition to the Ontario Caregivers Association. And we do encourage you to check that out. And again, if you forget any of this, we can always connect you through Jane and otherwise. So, and I think there's another question. Oh, and thank you to Kathy for she's saying how much she's appreciating the presentation online.
Yes. Awesome. Yes, and as I'm just repeating, but as you mentioned, Shreed, there are 5 others. You mentioned Alberta, you mentioned others, so people can access that. Is it the same heading, like
No, so
caregiver?
they're all independent
different?
organizations.
Different
Yeah.
titles?
But if you go to the Canadian Centre for Caregiving Excellence, they have all of them listed. So that's
Okay.
one place you can go. Canadian Centre for Caregiving Excellence.
Canadian Centre.
That's a
We'll,
national organization.
We'll get that and
Yeah.
pass it around as people.
I just want to thank you for being here and having had a recent experience, long experience with caregiving 10 hours a day, not a week, easily. And I've found I didn't see OCO mentioned in any of the institutions that I was with. And I found that the expectation is that family caregivers are expected to know a lot. And they'll hand off, but even simple things like how to deal with a catheter, I found that the staff in the hospitals aren't competent with them either. So their ability to teach us or even to instruct was limited. So there's a lot still to be done. I'm glad you're here. I'm glad you're here in the province, and we'll chat further.
Yeah, absolutely. 100% agree with what you're saying. We're also trying to work with all of these different standardizing agencies as well to make sure that we're here to support them in kind of around the caregiving at least support. So hopefully in the next couple of years, we'll be able to say, hey, we got that. Yeah.
Just a question I know. Oh, Jane. Well, it's a broader question. Again, sometimes people don't know where to look or where to ask. As a minister, sometimes people will, I have these conversations with folks. Sometimes they're not particularly satisfied. I mean, they don't know what to expect or what's fair to expect from professional services, whether it's a nurse, whether they're a family doctor, or they need to change something, or they, and it affects the person they're caring for as well. Is this number or this contact something that people can go to as a start to say, look, I've got a problem with something and it does involve the care, but it may not be something within your immediate purview, or I don't know?
Absolutely. Like I said, the helpline is supposed to be that one-stop shop. It's supposed to help you. And the people who are responding in the helpline, they're all being trained to kind of do like a quick assessment of the person who's calling to make sure that, that they're referred out to the appropriate services. Now, there are times where it's a little bit more complex and the resource specialists are not able to do that. There is an internal mechanism where they can say, okay, you know what? We have what we call a caregiver support team internally that picks up those calls, and we will call the person back to make sure that nobody's, left without any resources. So there is that safeguard mechanism in case. But in the event that it is an emergency, then the helpline staff will directly connect them with 911 as well. So all of that is taken care of. Yeah. But you can call. If there's anything around your needs or the person you're caring for, the helpline is the way to go. It's a really great resource.
I just have a comment. I think the family docs, I don't know if you're doing any work with the family doctors, but you know, when you go in, they don't really provide you with any resources or information. I think even if you say I'm a family caregiver. So how are you dealing with the family docs?
So we have what we call the Essential Care Partners Support Hub now at OCO. Basically, the way that it works is Ontario Health has funded us to work with providers. That's what they say, right? Providers. So we have a staggered approach. The first year we worked only with hospitals. The second year we worked only with long-term care, right? Now we're in the third year, we've started working with community care. So it has only just begun. We're a couple of days into Q1, right? So we've only started begun. So our aim is to start working with family health teams and community health centers to begin with. Solo docs, unfortunately, are not even in the purview at this point. It's just based on capacity. But if we do come across them, if someone refers, then yes, we will work with them. But in terms of active outreach, right now we're working with those three sectors, and of course, and also retirement centers. Also, we've started working with them. If the aim for Ontario Health is by the end of this year, 2026, I believe, by the end of 2026, each hospital in Ontario will have what they call an essential care partner program. That's the aim. So we're starting with the hospitals, and the way that the OHTs, the Ontario Health Teams, are set up. I don't know if anybody's heard of this. They call it the hub and spoke model. I don't know if anybody's heard of this. Like a bicycle, the hub and then the different spokes, right? So the hospitals are meant to be that hub that refers out to the different community agencies, the spokes. So hopefully once we get the hospitals involved, then they in turn can kind of start spreading the word, right? But yeah, it is unfortunately a slower process, but we are at year 3, yes, and we will continue to move along.
Thanks. I'm just wondering, you mentioned the hospitals. Who would be the contact person or the contact group in the organization? Just social workers?
At a hospital?
At a hospital.
Yeah, more than likely the social workers. But Ontario health teams have what they call the PFACs, Patient and Family Advisory Councils. That's what they call them, PFAC tables. So basically what these tables are, they comprise senior hospital administrators along with patients and family as in caregivers who sit at this table and say, okay, this is what the need is for this area, and the hospital should focus on those. So we have a staff member at OCO who's dedicated working with all OHTs and PFACs, patient and family advisory tables, to make sure that they're all aware of OCO and the programs that we offer, so that in the event once the meeting does happen, the hospital administrator is able to essentially circulate that information down to all of the social workers. That's how they envision it. If it's happening everywhere, maybe not so much, but that is something that we're working towards.
Just one last question, and again, I'm thinking about things that I've been asked. Advocacy, now I know we mentioned the hospital has its own internal systems in terms of advocating for a patient, but outside of that, even navigating, right? Whether it's the organization specifically where one would find an advocate or the system, is that something that you folks would help guide and direct people?
Yes, navigating, absolutely. Navigation through the helpline, just based on where you are. I'm looking for X, Y, and Z services. My so-and-so just got discharged. I'm looking for physiotherapy, or I'm looking for a speech-language pathologist, whatever it may be. We will navigate that person to that service based on the postal code that they're calling from, right? In terms of advocacy, because we're funded by the ministry, we don't do as much advocacy, but we offer information. So we have a team that kind of gets data around what caregiving is, so everything that I presented, and we make sure that that data reaches the government to make sure that funding flows basically through what the needs are for caregivers, in particular OHTs. And every Ontario Health team or OHT has a different focus area. Some have mental illness, some have addictions, but there are, caregiving is kind of embedded within most of them, but that's how we're trying to kind of get our services to everyone. But in terms of navigation, helpline, everything, we help navigate caregivers and professionals. If there's a doctor, if you're in an appointment and the doctor says, oh, you know what, you need support for yourself, I don't know what to tell you, you have to find it, then you can say, hey, there's the Ontario Caregiver Helpline, you can call them and they'll be able to help you.
All right, thank you.
And we have heard that happen. We have heard that because doctors don't know that we exist. Yeah. Yeah.
Well, no, 'cause I was just saying, like, there's a lot of people who never go to the hospital who are caregivers. You know, their family doctor dealing with all of it. And my sister's been looking after her husband with dementia, but until this last year, he had never been in hospital. So had the family doctor had this information and given it to her,
Yeah.
for the last 7 years, it would have been extremely helpful. So to have started with hospitals as opposed to the grassroots stuff, it's sort of,
Yeah, I know. That was the way that it was mandated for us. So that's how we started. But hopefully now that we're in the community, we're able to kind of start spreading that word. So we're only 6 years in, right? So we're slowly trying to get to everyone. But hopefully you'll help me by spreading the word. So if you go to your doctor, let them know. Like I go to my doctor, I take resources with me all the time and make sure that he knows. I do that as well.
That was exactly what I was going to address. I've picked up a number of these cards, and I know at least 2 doctors that would be quite receptive to getting this information. And I'm wondering if you could do that with more people. Use us as conduits
Absolutely.
to go out there and,
Yeah.
inform the docs.
Absolutely. We encourage everyone to do so. Every presentation that we go to, if there are folks who want to work, or even if connect the doctor with us, then we can take it from there, right? So happy to do it. Happy to do it. Absolutely.
Well, this has been good, and I'm sure others will think of things, but let's bring it to a close. Shreed, you've been good to us. You presented us with a ton of information. There's a lot for us to take and absorb. We're so appreciative. Certainly, it's great to have this access, this information.
Thank you so much. Yeah.
And I want to acknowledge Jane. Thank you so much. Jane is a force. I'm sure most of you now know who she is. We would not have done today's presentation without her coordination and help. And of course, Jane, thinking of all the things, has provided a small gift to thank you for being here and joining us.
Thank you so much.
And Jane, do you want to add a couple of things? And I please encourage you all to take the newsletter in front of you.
Thanks, Erin. Yeah, I just want to thank Sharit. I think I've known you for around 12 years. Yeah. And if you go actually on our website, our homepage, you'll see Sharit. He was working with the Alzheimer's Society Toronto.
I had hair then, though.
Yeah. And we did a lot of community work about social interaction and social connection. I think that was like 11, I don't know, maybe 10 years ago we did that at, I think, Whole Foods, which was on Bayview. So you'll see Sharid there. But I just want to thank you. You did a wonderful presentation, and there's new things that I've learned as well that I can pass on. And definitely, I'll be sending your information to my family doctor, which is the Wilson family team on Wilson. I just want to remind people, please pick up our newsletter. We have lots of fun social events, and we're collaborating with Armour Heights Presbyterian Church and running this wonderful event, 1920s Garden Party. And that's going to be on June the 19th. June 13th. And we're having photo booths, flapper dancer, barbershop boys, ice cream trucks, stuff for children. So it's going to be a real lovely community day. So hopefully you'll come. If you just RSVP, just so we know, how many people to expect and for setting up and also for some food. If you want a picnic box, you can pre-order that as well. I think that's $10 we're charging, but we'll also have lots of refreshments as well. So thank you, and thank you so much, Sharid. It was a pleasure having you.
Thank you for having me, Jane. Thank you. Hey, amazing. Thank you so much. Yeah. Oh, loved it. Awesome. Thank you so much.
Yeah, the new things that I didn't know about the scale. I think I heard of the scale of the
Yeah.